You ready? I'd like to call the meeting to order. Stand for the pledge, please. I allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Is there a motion to adopt the agenda as presented?
Yeah.
Mr. Barry, seconded by,
Second.
roll call, please.
Mr. Barry?
Yes.
Mrs. Salapatta?
Yes.
Mr. Adavasio?
Yes.
Mr. Simon?
Yeah.
Mr. Messersmith?
The approval of the minutes of April 24, are there any additions or corrections? If not, is there a motion to approve them? So motion. Second by Mr. Simons. Roll call, please.
Mr. Adavasio?
Yes.
Mr. Simon?
Yes.
Mrs. Salapatta? Abstain. Mr. Barry?
Yes.
Mr. Messersmith?
Yes. Okay, the next one's the Health Commissioner's report.
Thank you, Mr. Chairman. You have my written report in your packets. The only thing I want to add to, there's a couple of items. First, under vehicles, where I said there was no update on additional vehicles that have been ordered. We were notified this morning that one of the vehicles is in and they are going to be delivering it here tomorrow. So, they didn't really give us much indication of the other vehicle, but much quicker turnaround this time around than the past two rounds that we've ordered some. So I'm anticipating we should have the other one here before long. And then, I also wanted to introduce our new health educator who's sitting behind me, Mackenzie, if you could stand up, please. Mackenzie Hestrick is our newest health educator. She just started here a couple weeks ago, and she's working the tobacco grant. And if you recall, that traditionally has been worked on under the nursing division. And as we're transitioning our nurses into the new Family Connects grant, as well as some of the other funding sources like BCMH and things of that nature, they're assisting and training Mackenzie as well as Aaron and Jana into the tobacco grant, which the next round is fully implemented in the beginning of July. So we're hopeful to have Mackenzie ready to go by July the 1st with taking over on the tobacco grant. So, Mackenzie, if you want to say a little bit about yourself.
So I just graduated my MPH in August. Before this, I worked at the hospital in the clinical lab, and my concentration was epi. I really like that aspect of it and disease prevention, but I'm really excited to look at different level of prevention in tobacco. And I'm excited.
Thank you and welcome to the organization.
Thank you.
I know you're very busy. You have to learn by the 1st of July, so you can go back to work.
Thanks.
Thank you.
That's my report.
Any questions on the report or for the Health Commissioner?
Do we have any oversight or any involvement at all with since the legalization of the marijuana with the new stores predicted to be open or sales staff? I don't know what they're gonna have.
At this point, they have not put any of that onto the local health districts. So it could change down the road, but as of right now, no. I mean, the main thing I think that we're working with the county on any policies for drug testing and things of that nature. More for our employees, though.
Seems to me they did a lot of this without thinking it through and just, it's legal. Now what? Thank you.
Sure.
Any other questions or comments? If not, is there a motion to accept the report as presented with the additions? So motion, seconded by Mr. Barry. Roll call, please.
Mr. Adavasio?
Yes.
Mr. Barry?
Yes.
Mrs. Salapatta?
Yes.
Mr. Simon? Yes. Mr. Messersmith.
The nursing, director of nursing report that you have in front of you. And the addition paper that was on your. On the Steve is, goes with that report. Is there any questions anybody has after you've read the report? There's no questions or comments. Is there a motion to accept this report as presented to us?
So moved.
Seconded by Mr. Barry, thank you. No further questions, roll call please.
Mrs. Salapata? Yes. Mr. Barry?
Yes.
Mr. Adavasio?
Yes.
Mr. Simon?
Yeah.
Mr. Messersmith?
Yes. The next one is the Director of Environmental Health Report, which is about 1.7/8 of an inch smaller than it was last week.
Yeah, thanks for allowing that to be trimmed down, but yeah, I provided a written report and it is smaller. If you have any, I don't have anything to add, but if you have any questions, I'll answer.
You have nothing to add?
No,
Okay. Are there any questions for our environmental director? Any questions? If not, is there a motion to accept the report that's presented? So motion. Second by Mr. Simon. There's no further questions. Roll call, please.
Mr. Adavasio?
Yes.
Mr. Simon?
Yeah.
Mrs. Salapata? Yes. Mr. Barry?
Yes.
Mr. Messersmith?
Yes. Is there a motion to accept Mr. Dubus into the meeting?
So motion second.
Roll call, please.
Mr. Adavasio?
Yes.
Mr. Barry?
Yes.
Mrs. Salapata? Yes. Mr. Simon?
Yeah.
Mr. Messersmith?
Yes.
Did you ever not accept anybody until the meeting?
You're getting close. You're getting there. What would happen if we didn't? We turn around and go home?
Yeah.
Then you want your parking validated, right?
Yep.
I don't believe we have to have an attorney in the meeting. He just dropped in. Thank you, sir. The next thing is the grants coordinator report. I think she's here today.
Yeah, thank you, Mr. Chairman. I provided a written report, just a couple updates. The Family Connects program that Frank was referring to. There's been a little bit of delay at the state level getting the contracts to us as provider agreements. So it's still gonna happen. There's just a little delay. It didn't start this month like it was planned. It'll probably start in June, but we still have plenty of time for that. And then you'll also see in the report for the COVID-19 enhanced operations grant, they had some funding left over, and we submitted for additional funding to help cover some of the costs that were not previously covered under the grant for the renovations done in this building. So we're waiting to hear from ODH, hopefully soon, if that's all approved, to help cover some of those costs coming out of grant funds. Let me know if you have any questions.
Are there any questions for her? There's no questions. Is there a motion to accept the report as presented?
So moved.
Seconded by,
Second.
thank you. Roll call, please.
Mr. Dubus?
Yes.
Mrs. Salapata? Yes. Mr. Barry?
Yes.
Mr. Adavasio?
Yes.
Mr. Simon?
Yes.
Mr. Messersmith?
Yes. Okay. The next one is the accreditation coordinators report. We have the presence.
Thank you, Mr. Chairman. I prepared a written report. The only thing I'd like to add is with your board packet, and we'll discuss the new business, there's a sign-in sheet or a signature sheet for the monitoring component that we've added to the strategic plan. We're not going to use that one. I'm actually going to grab a color copy from my office at the end of the meeting, and that's the one I'll have this.
For us,
Just for you in particular, Mr. Messersmith. Everybody else, the management, the department heads and the health commissioner, I'll have them sign after.
each meeting or?
No, just this one time.
And that will be microfilmed and sent where?
Well, I don't know if it'll be microfilm, but we'll definitely archive it and it will be held.
And the purpose of it,
So we actually wrote the strategic plan prior to the new standards and measures coming out. It was written in 2021. The new standards and measures from FAD came in 2022. And they added a new component, which was a monitoring component. Luckily, we had already had a strategic planning dashboard that we used. We just hadn't written it into the plan at the time. We saw it coming and we were proactive. So now that we've got those dashboards under control, we report on a regular basis. We wrote it into the plan.
Okay. Any other questions for the gentleman?
Dan, when I was going through this, these reports that you give us,
Oh, the performance
like,
management dashboards.
yeah, the dashboards.
Mhm.
Like, on some of these, we're in a negative figure on some of the funds.
Mhm.
But you have an operating ratio. What is a good operating ratio for these funds?
Well, we usually try to stay between 0 and 1. So if it exceeds 0 to 1 in either aspect, then we're moving in the wrong direction.
Okay.
Any other questions or comments? If none, is there a motion to accept the report as presented?
So moved.
Second,
Second.
roll call, please.
Mrs. Salapatta? Yes. Mr. Barry?
Yes.
Mr. Dubus?
Yes.
Mr. Adavasio?
Yes.
Mr. Simon?
Yes.
Mr. Messerschmidt?
Yes. The next one is the. Health educator report. Yes, sir, go ahead.
Thank you,
Yeah,
Mr. Chairman. I have provided my written report and can answer any questions you may have.
Is there anything that you think that we should be directed our attention to? More so,
Not really specifically. I mean, I can give some quick verbal updates. We're gonna, for the Trumbull County strategy, we're gonna be starting to do those assessments. Trying to get at least one in before next week, as I will be introducing the assessment process to the Youngstown State University students. So obviously they need to be informed and educated on how to properly do them. So we wanted to have an example. And then just the other one I would state is, Now City, unfortunately, we did not receive the AARP funding for the benches along the disc golf course. So, as stated in the report, that'll probably be held up until a later time, as we don't have the funding, and I don't believe the city does as well, but the disc golf course is still on par to have it. We have 18 holes at Stevens Park. So those are the only two items that I would think to address.
it might be wise that the benches were not done now, with what Newton Falls, they're complaining about the color of the benches.
Oh, really? I didn't hear that. Well, what color are they?
Better.
Red, white, and blue.
They asked the communities input, we would have asked the communities. input.
Yeah, that's true. We do a lot of community engagement, so that way there's not that, black about making updates to.
Be aware, it's out there. Any other questions?
Chris,
Yes,
in the past, we've asked about like food deserts, I guess if they were calling, Mr. Messerschmidt asked about the one in Brookfield and Masery.
yes.
Are they still addressing those?
That is still being addressed yet, not specifically by us. I do sit on a committee where that is a discussion. And Trumbull Neighborhood Partnership is still trying to open up more healthy food retail stores, or at least the community stores that are already in these areas provide fresh produce. So it's still a project. It doesn't always work very well. It's difficult to sustain that, but it's still being addressed. And it's also part of our strategic plan for the county. So yeah, we're still trying to figure out ways to incorporate healthier foods in all of the areas that are lacking.
Okay, thank you.
And the attorney can confirm that the food desert they had in Brookfield with Scotty's carryout, they're building a new General Dollar right next door.
Oh.
So it'll take care of that.
Oh,
Hopefully, there are some Dollar Generals that are providing fresh produce,
Right.
but I think there's one in Niles, but I don't know if they're trying to expand. It's been a little bit difficult working with them. What's that?
Middle Ridge. does.
Oh, do they? Okay.
There's one in New Wilmington. That's in Pennsylvania.
Yeah, right. Yeah, I know they're starting to open them in some areas, but not all of them provide that. So hopefully it alleviates that.
thank you.
You're welcome.
Any other questions or comments? If not,
Is there a motion to accept the report as presented? Thank you. Mr. Lou made it and seconded by. I'll second it. Thank you, Greg. There's no other questions. Roll call, please.
Mr. Adavizio,
Yes.
Mr. Dubus.
Yes.
Mrs. Salatata. Yes. Mr. Barry,
Yes.
Mr. Simon,
Yes.
Mr. Messersmith.
Yes. Is there a board report? Anybody have anything that they want to present to the board? And if not, is there any old business? No old business, is there any new business?
Yeah, there's plenty of new business.
Yes.
You want me to go?
Sure.
Oh, this is me. This is
No.
Dan. I'm sorry, I jumped ahead. I apologize.
Oh. No, there was, did someone have something on the new business they were gonna bring up?
No.
Yeah, I'll start. Thank you. Yeah, so, A is my approval of the monitoring component.
Oh, okay. I'm sorry. Yeah, we'll start with new business. A, go ahead.
Okay, so as I discussed before, we wrote the plan in 2021. These new standards and measures came out in 2022, asking for this monitoring component. I'm just asking the board that they approve this monitoring component, and all I'll need is a signature from you, Mr. Messersmith, which will go with the signature page of the current plan. Yes, but I'll get the actual.
Second page actually describes the monitoring component.
Correct,
Okay. That's on the back.
right there, yes. And this basically outlines what we do on a quarterly basis
When did we leave that?
It's been a while, but
regarding the strategic plan.
Yeah, because it says quarterly and I wondered.
So
I knew we were over in the old building.
we meet internally on a quarterly
okay.
basis. The accreditation quarter, which consists of basically the administrative team, meets on a quarterly basis and discusses the updates with the strategic plan. We're on target with everything, and our dashboards reflect that. And we post those in the communal area over in the mailroom, so the entire health district can see. The strategic plan is an internal component. We don't report that out to people. It's informed by our CHIP. It's what we do to achieve those things outlined within the CHIP. So, and this is just a component we need to add due to those new FAB standards and measures. So I'm asking the board to.
is there a motion to approve this? Proposal, Jack. Cheryl, they seconded. Any other questions or comments? If not, roll call.
Mr. Simon,
Yes.
Mr. Adavizio.
Yes.
Mr. Dubus.
Yes.
Mrs. Salatata.
Yes.
Mr. Barry,
Yes.
Mr. Messersmith.
Okay. Variance request, Joshua Ulrich, 6602 Chestnut Ridge Road, Hubbard Township.
Yeah, so this one's me.
Are they here?
Are you, Mr. Orr? No, okay. So this was, they're in the process of putting in a new septic system and the layout is gonna be closer than 10 feet to the porch of the driveway. So they, in essence, they're asking for a variance to the 10-foot setback rule. The inspector is fine with it. I'm okay with it. So, I would ask the board to adopt the motion as presented.
Is there a motion to accept this original motion? Seconded by
Second.
Kathy. Any questions or comments? If not, roll call, please.
Mr. Adavizio.
Yes.
Mrs. Salatata.
Yes.
Mr. Barry,
Yes.
Mr. Dubus.
Yes.
Mr. Simon,
Yes.
Mr. Messersmith.
Yes. The next item is the declaration of unfit for human habitation. 8401 Squires Lane, Allen Township, Market, V.L. Tyson, owner.
So this one comes to us from Howland Township zoning. As you can see from the pictures, in essence, gross unsanitary conditions. There's a note here, it says the structure is in horrible condition, very horrible and very poor condition. So I'd ask the board to adopt the motion as presented.
Is anyone here?
You're not representing them?
There's somebody online.
No, that's first. That's our first.
Oh, okay.
Is there a motion to, is that the house? The outside of it? Okay. Is there a motion to declare this property unfit? So moved. Seconded by.
No second.
There's no other questions or comments? Roll call, please.
They have it right.
Yeah, right on here, but. Sorry.
Ready?
Yes.
Mr. Dubus?
Yes.
Mrs. Salapatta?
Yes.
Mr. Barry?
Yes.
Mr. Adavazio?
Yes.
Mr. Simon?
Yeah.
Mr. Messersmith?
Yes. The next one is declaration of unfit for human habitation, 936 Scoville North, Lyon Township, Gregory and Brenda File, owners.
That would be us.
You're here, okay,
Yes, we're here.
good, glad to see you.
Okay, so this one comes to us from Vienna Township trustees, missing badly damaged ceiling tiles, solid waste, mold, gross unsanitary condition. I'd ask the board to declare the structure, or I'd ask the board to adopt the motion as presented.
Yes, unfortunately,
You can speak now, Matt.
I'm sorry.
It's okay.
Unfortunately, his father, my father-in-law and my husband all passed away right around the same time. And we inherited this. So we have no clue what to do with any of it. We're trying to sell off property, as it goes, but I do have an estimate. I got to this morning, an estimate of, for tear down. And we're waiting for a couple more estimates to come in.
That's south of New 82.
Yes,
So have you guys talked to the land bank at all?
no,
Okay, I'd advise to call the land bank, because right now what they're trying to do is they're compiling a list of unfit properties. They're trying to get some help with money wise to take them down.
seriously, that'd be great, because we're like
So what we,
freaking out over it.
so what the board does in this, if they were to declare this unfit, what our role is to do the inspection, declare it unfit, and then it goes back to the townships to do something with it.
Okay,
So this is literally our only role here, and then we'll go back to the townships. But if you contact the land bank and get them this address, see if they can get it on their list. I don't know, see, a lot of the land bank had told a lot of the townships, give us all the unfits, and we've been going them for months and months and months.
really,
So they might be able to keep some money out.
that would be great. We're, like I said, we're just like,
You guys are all here for the same property?
yeah, 'cause it's in his and my name.
I don't have the number off the top, his name is Matt Martin, I don't have his number off the top of my head, but if you call the land bank. Yeah, and tell them that the Board of Health declare your house unfit, and I told them something, because I don't know if it was finalized or being finalized, but it's worth an ask. I think this is a.
Okay, yeah, cause I was looking for grants online and the only one I saw said that the
They did work
application was
looking into.
so we
Okay,
couldn't go there.
well, call and ask.
Okay.
Yeah, you let them tell you it's closed, just here, call and ask.
Now, this was my grandfather's house, but my dad next to him.
Yeah.
I don't know why, he was like, then they passed away, now,
Yeah.
now it's in our lap.
Okay.
And
Your probate file and everything on
Yes,
that? Okay.
Yeah.
So is that finished?
Yeah.
yes,
So now you can go ahead and sell everything off.
Yes.
And that's always.
Yeah.
I did it for years.
Set it on fire.
we asked,
He didn't have a will.
Yeah.
He kept saying, yeah.
A lot of the fire.
underneath the trees.
Yeah.
Depending on the area. So.
Yeah, so it's all been, probate, everything back, it was in my husband's name, and then when he passed away, had to go back into probate to come into my name.
Okay.
So it's all taken care of. We have actually sold half of it. The junkyard side is already sold. We're just working on this side now.
Okay. Yeah, I'd call Matt.
Okay,
Is there a motion to, in fact, declare this as unfit?
So moved.
Second. Mr. Berry, seconded. Any further questions? If not, roll call, please.
Mrs. Salapatta?
Yes.
Mr. Barry?
Yes.
Mr. Dubus?
Yes.
Mr. Adavazio?
Yes.
Mr. Simon?
Yes.
Mr. Messersmith?
Yes.
Mr. Chairman, just a quick question. On the screen there, they had the address as 939.
No.
yeah,
There.
936.
Just want to make sure we have it right on the paperwork.
I do have one other question. Is there a time limit on getting this taken care of?
You'd have to talk to the township,
Okay,
because we'll send them a letter, because they're the one who requested it, and so you're now on their time frame. So work with them, they'll probably give you time. If you're working with them, if you're doing nothing, that they might shorten their time.
yeah, that's true, that's
But I
true.
don't think their phones are answering anymore.
Yeah.
Yeah,
no.
Yeah,
Phone's ring, there's just no one to.
Yeah,
and this.
Yeah.
Which one of you is related to Paul?
I'm,
Yeah.
Paul Frog.
yeah, that's my, was my.
Good dad, he was a fine man.
Interacting.
Fine man, I very appreciate, respected him very much. Miss him. Sure you do.
Make sure you call Matt. Call Matt.
Okay.
Okay, the next item is,
I gotta get out here.
Thank you so much.
salary adjustments for an advancement for Tony Betts.
Yeah, so. You can see in the write-up, Tony is a sanitarian too. The time frame to advance to a 3 is 10 years from a 2 to a 3, and he's got that requirement of 10 years, so. Asking that the board advance him to a sanitarian 3.
Is there a motion to that effect? Second,
Second.
Mr. Barry. Any questions or comments? If not, we'll call. Go ahead. One question.
How can they have a 10-year time frame for the one to the other?
Well, we have it from a 1 to a 2, we had it 5 years, which still is the case, and then from a 2 to a 3, 10 more
Okay.
years. So it's a total of
Total
15 years, you'll advance to the highest level you can. It's a means of keeping individuals here, so, it's, for longevity purposes.
Okay. So the level 3 is the highest they can go. Correct. 3A. Roll call, please.
Mr. Anavazio,
Yes.
Mr. Barry.
Yes.
Mrs. Salapatta.
Yes.
Mr. Dugas.
Yes.
Mr. Simon.
Yes.
Mr. Messersmith.
Yes. Are there any citizens' comments? If not, is there a motion to go into executive session? Pending litigation,
So moved.
seconded by
Second.
Kathy. Roll call, please.
Mr. Dugas.
Yes.
Mrs. Salapatta.
Yes.
Mr. Barry.
Yes.
Mr. Anavazio.
Yes.
Mr. Simon.
Yes.
Mr. Messersmith.
Yes, you need,
Our legal counsel, I'd like Chris to be in here as well.
okay, the rest of you.
Chris Wilson.